We will wait for 2 more minutes and then we'll start, Vibhuti.
Sure.
Hello everyone. This is Rohit from the Ivory team, and I think we should begin the quick Q&A. So we have Vibhuti Kanakia with us. I hope I'm pronouncing that right, Vibhuti.
Yeah, you are.
So she is an expert in physiotherapy, and she has conducted a podcast also with us previously where she gave a lot of insights on how things I have evolved with time in terms of how Indian and Western things have changed, and also in terms of what's happens to your body as you age. So I think she is an expert in that zone. So it would be great to hear from you and understand the questions which have been posed to us. So we have mixed some of your questions because they were of similar issues. So we have clubbed them together and brought down to 15 so that we can focus on each question and Vibhuti can take us through them. So yeah, over to you.
Thank you so much, Rohit. It's been great being associated with Ivory. I see a lot of senior citizens in this group. So is it okay if I can combine English and Hindi together so people can understand it better, more clearer? So you guys will be okay with it?
In comment, please say no if you Hindi is not your language. We will just get to know.
Yeah, I'll be talking a lot in English also, but I will combine a little bit of Hindi so that people can communicate. I mean, they can understand better. That's my only this thing.
Yeah, whosoever is raising their hand, please share in the comment section because we have not kept the voice open.
Cool. So I'm Dr. Vibhuti Kanakia. I specialize in sports injuries, ergonomics, and orthopedic problems. Ergonomics basically means work-related problems, people who are working, who are in corporate world. And it's not only corporate world, it also matters ke jo ghar mein women who are working, women jo khana paka rahe hain, jo basically when you have something called stirring of your hand also, usse bhi, that those also come into the ergonomic issues. So I specialize in those problems, and I'm hoping that I should be able to answer all your queries today. Rohit, on to you.
Awesome. So I'll take the first question. I've been diagnosed with trigger pain in the second finger of my right hand. Can you advise what should be done?
So trigger finger is also known as tenosynovitis. It normally happens in the first finger, means your index finger and the thumb. Agar second finger mein hua hai, means there is some work related issue that must have happened. Trigger finger means there is a tendon which goes from your wrist and it goes into your fingers, which gets swollen. Normally, trigger finger happens because of repetitive activity. So whoever has got this kind of a problem, please think what activity you have been repeatedly doing. एंड एट दैट पॉइंट स्टॉप दैट एक्टिविटी. जो भी आप काम कर रहे हैं, मतलब फॉर एग्जाम्पल कोई मालाजी करता है या कोई कुछ खाना बनाता है जो कंटिन्यू स्टरिंग करता है या कुछ सिलाई कर रहे हैं, मतलब एनीथिंग कुड हैव बीन देयर एंड दैट triggers that trigger pain or that triggers that pain in that second finger. The most important thing should be done is icing. If the pain is very, very severe, I suggest you show it to an orthopedic surgeon and put a splint. Painkillers do work, and this is all in the initial phase where physiotherapy cannot be done. अगर वो pain बहुत ज़्यादा severe है, swelling बहुत severe है, तो आपको wait करना है. You cannot immediately go for physio because आपका pain बढ़ जाएगा. Icing कीजिए, painkillers ले सकते हैं, splint पहन सकते हैं, and after that, when your pain comes down maybe by around 20 to 30%, then you can go to a physio and start with exercises. I hope the question has been answered, Rohit.
Yes, I think it has been answered.
Yeah. So that is what that is how the protocol normally works with a trigger finger.
The next question is, I think, quite common that has been asked around: how to manage sciatica pain without medication? Sciatica pain.
So sciatica pain is a symptom. Sciatica pain is not a condition. वो एक condition नहीं है, वो एक symptom है. It is a symptom of a problem in your back. People who have pain with sciatica, first thing उनको कराना चाहिए एक MRI. MRI में you will see कि some level पे it is basically sciatica pain का मतलब ये होता है कि there is a nerve from your lower back which is going into your leg जो दब रही है back में, which is getting compressed or which is injured. तो सबसे पहले वहां पे आपको MRI करके पता चलना चाहिए कि at what level वो sciatica nerve दब रही है. जो वहां लेवल पे दब रही है, according to that the treatment starts. According to that we can figure out that what exercises will suit you. अभी देखो उन्होंने क्वेश्चन ये पूछा है कि without medication can I do it? So that all depends on the degree and it all depends on the variation of pain. Pain can be scaled between 1 and 10. So if you are somewhere between 3 and 4, yes, you can manage it without medication. But if you are at a higher pain level, why go through it? What is the need for it? Why do you want to go through it? Why do you want to be without medication and suffer? And medication lifetime नहीं होता है इसमें. It is just very temporary for some time. उसके बाद there are a lot of other ways that you can reduce your pain. There are a lot of exercises. There's a lot of core training. There are a lot of movement analysis that we do in physiotherapy where this pain can be easily managed. Surgery ये केस में एक last option होता है. मतलब option बहुत ही कम होता है surgery में unless and until आप bed से उठ नहीं पा रहे. तो ये एक प्रॉब्लम है जो कौन सा आपका स्केल 1 to 10 में आपका स्केल क्या है पेन का, उसके ऊपर ये मैनेजमेंट इसका चालू होता है. सो यस, मेडिकेशन के बगैर आप रह सकते हैं, बट only if the pain levels are less. If the pain levels are high, I don't suggest you all to stay without medication because no, that's not a practical thing to do.
Just adding to it, how common is it to have a sciatica pain?
Very common, very common. In fact, there used to be a myth that this kind of pain is there only in the population above 50s and 60s. It's not true. Today, I'm getting young boys who are 17, 18, 19 who are having this kind of pain because the level of activity in the gym has become so high. हम कितना ज़्यादा वो लोग weight training कितनी छोटी उम्र में शुरू कर देते हैं. They all start going to the gym at the age of 15 and 16 because, you have a craze to have a good body, which is okay enough. But the problem happens when you do that weight training without proper guidance. When you do it, when you do not have a trainer who's guiding you properly, or you don't keep a trainer only, so your positions are not correct, and then you're lifting really heavy weights. तो वो डिस्क जो होता है बैक में L3, L4, L5 का जो डिस्क होता है वो बाहर निकलेगा ही निकलेगा क्योंकि उस पर इतना लोडिंग है. तो वो निकल के वो नर्व को पिंच करता रहता है. तो दिस इज वेरी वेरी कॉमन. इट इज नाउ across a range of now age group. Now it is not fixed to a certain age group now. It is very common with पोस्ट प्रेगनेंसी ऑल्सो, women who have just given birth के बाद भी ये बहुत कॉमन है. तो हर एज ग्रुप में होता है. Again, without medication, I mean, it all depends on what scale you are. I don't believe in making a patient suffer unnecessarily. कि आप बस पेन किलर के बगैर ही सहन करते रहो, वो गलत बात है. थोड़े दिन लेना पड़े तो उसमें कुछ वो नहीं है. There's nothing wrong in it.
Got it. We have gotten a question around it on the Q&A.
Hmm.
Hi, 5 days back, I fell on stairs, which hit my tailbone. Have extreme back pain. Fracture is not there. So, what is the cure? I don't think you can give the cure, but
So this, when you have a tailbone problem, okay, so there's no cure to it. But I mean, right now, I mean, without seeing you, there is no cure. But tailbone pain has nothing to do with sciatic pain. Again, tailbone is a pain of the coccyx, which is the last part of your spine. वो जो पेन होता है ना, वो पेन has a very very different treatment plan compared to a sciatic. So there is no connection between these two. At this point, you need to ice if you want to do something just few days back since it's happened, and sit on a ring before going to the doctor. Ring पता होती है आप लोग को, स्विमिंग पूल की रिंग होती है ना, हम जिस पे स्विम करते हैं, हम बच्चे स्विम करते हैं, that ring. So basically you don't sit on any hard surfaces. You sit only on soft surface, or you sit on a ring so that उसके ऊपर pressure नहीं आए till you are not diagnosed properly or till you are not treated properly. So you sit on a ring, go to the doctor, go to the orthopedic, or go to a physio if the pain is not, if your injury is not too bad. You can go to a physio also, and the treatment can be done. It's quite straightforward, actually.
Moving on to the next question.
Yeah.
Recently diagnosed with chondromalacia patella. Are there any risks if I lift heavy weights?
Okay. Chondromalacia patella, again, a very, very technical term. So, audience ko, I will just try to explain what is chondromalacia patella. ये हम chondromalacia patella जब हमको होता है, तभी हम MRI में ये word हम सुन लेते हैं, but हमें पता नहीं होता है क्या होता है. Knee joint is made up of two joints. Okay, it is not made up of only, it's not only one joint. So one joint is the patella जो होता है, जो हमारी knee की ढक्कनी होती है, that ढक्कन is also making up a joint with the knee. That is called the patella. Chondromalacia means degeneration of the patella. जब patella starts degenerating or the patella shows aging process, it's called chondromalacia. Now, chondromalacia patella comes in grades. It comes in grade 1, grade 2, grade 3, grade 4, grade 5. When the grades are, and it is very, very common in young people. So it is not even, old लोगों में तो होता ही होता है, about 60 तो होता ही होता है, मगर young लोगों में ये बहुत ज़्यादा common होता है. The biggest problem in chondromalacia patella they have is when they are going down the steps, they have severe pain. जब स्टेप से नीचे उतरते हैं तभी पेन शुरू हो जाता है. That's when, जब वो वजन देते हैं, that is when they feel that we have pain. That is one of the signs of chondromalacia patella. Lifting weights, again, a very, very broad spectrum question. How much weights? What is the degree of your chondromalacia? This all depends on that. If you are somewhere between grade 1 and grade 2 of chondromalacia, means it's the beginning of degeneration. Yes, you can lift weights with a kneecap. You have to wear a knee support and protect your knee. And you can do weights at a very, very slow rate. Means you do not lift very, very heavy weights. And if you're a little bit also uncomfortable, stop. If you're somewhere post grade 3 and 4, I would suggest not to lift weights at all, because it's just going to fasten your process of making the degenerative changes will become faster. So if you want to save your knee joint, don't lift too heavy weights. Basic weight training कर सकते हैं, basic चीजें कर सकते हैं. Suppose if you are a male, maybe with your legs you can take around maybe 20 to 25 to 30 kilos. If you're a female, maybe 10 to 15 kilos. So उससे ज़्यादा ना करे तो better है. So again, everything depends on your X-ray. It all depends on your MRI. It all depends on your exact diagnosis. It all depends कि आप कौन से grade पे हैं और कितना weights lift कर रहे हैं. But strengthening of the knee has to happen. Chondromalacia does not become better. You have to strengthen your knee at every given point.
And strengthen with body weight or weight that you're comfortable with.
The best thing to strengthen is with your body weight, or strengthen with regular strengthening exercises like therabands kar sakte hain. You can take half kilo sand weights and do weight training. That the whole guiding process your physio normally lands up making you do. So you do it during according to that, but exercise is a must. It's something that you cannot stop. Because chondromalacia, again, the quadriceps have to be very, very strong. आपके hamstrings बहुत strong होने चाहिए. So ये दो चीज अगर आपकी strong है, जो weight training से होती है, but कितना weight training वो आपके grade पे होता है, और कितने weights वो आपके grade पे होते हैं.
So moving on to the next question then.
Yeah, anybody who has any question, you can let me know related to the knee.
Add them, yeah, add them in the chat, or you can even ask a Q&A. So there are two ways to do it.
Yeah.
Moving on to the next question. I recently developed a tennis elbow. Besides medication, what can I do? Is cycling a good remedy exercise?
साइकिलिंग से कुछ टेनिस एल्बो मतलब यू कैन साइकिल. टेनिस एल्बो मतलब कोई प्रॉब्लम होगा नहीं इफ यू साइकिल. इट्स अ गुड एक्सरसाइज इन जनरल. टेनिस एल्बो इज बेसिकली अगेन देयर इज अ टेंडन व्हिच गोज इनटू द outer part of your elbow. I'm sorry, I'm using very layman terms to make people understand this. So it is the outer part of your elbow where there is a tendon which gets attached to your wrist. So the extensor tendon, which we call, and that tendon gets swollen. That's how tennis elbow happens. टेनिस एल्बो का नाम दिया है, मगर टेनिस एल्बो सिर्फ टेनिस प्लेयर्स के साथ नहीं होता है. टेनिस एल्बो कैन हैपन टू एनीबडी. ऐसा नहीं है कि टेनिस एल्बो सिर्फ टेनिस प्लेयर से आता है. टेनिस एल्बो तो गोल्फ जो हम खेलता है उससे भी होता है. You have something called a golfer's elbow also. I'm sure people must have heard of it. तो golf जो खेलते हैं उनको भी टेनिस एल्बो होता है. We have one of the best cricketers in our country, Sachin Tendulkar, who suffered from a tennis elbow for years. And unfortunately, he had to go through surgery because it didn't become better. And it doesn't become better because he's playing a sport which is like that. But लोग जो sport नहीं खेलते हैं regularly, people who are not, playing on a professional basis, tennis elbow is very, very manageable. Medication and what can you do? There are a lot of exercises you can do. Tennis elbow अगर आपको हो रहा है, normally it happens because you have lifted weight in the wrong angle. So when you lift weights, any weight, it could be actually just a glass filled with water. Rohit, I've seen that also. I've seen कि glass पानी भरा glass अगर आपने lift किया है wrong angle में तो आपको tennis elbow हो गया. मतलब it is so bizarre. So any weight you have lifted, मतलब आप बाल्टी में से वो, I know people who have come कि हमने पानी निकाला बाल्टी में से और हमको elbow में दर्द होने लगा. So it's the angle which is bad. Medication is basically just to reduce the little bit of swelling. Icing normally works really well. You have a tennis elbow band, which is very, very, very helpful. That band, how to wear it, normally your physio will show. Exercise is a very, very good way to keep your symptoms less. You don't get many symptoms if your exercises are there. But one thing I have seen in my so many years of practice is tennis elbow keeps recurring. अगर आपको एक बार हुआ है तो आपके chances हैं आपको वापस होगा. But then if you have taken proper physio, you know the protocols. So you know what to take care. तो अगर होता है, so I have patients who come to me, they had a very bad tennis elbow, they get okay, they go back to their normal life. फिर 1 साल 2 साल हो गए, वापस वहाँ पे दर्द हो गया, they will just call me and they're like, okay, we've got the same pain. I will tell them, I start wearing your band again. जो exercise मैंने सिखाई थी वापस शुरू कर दो. Okay, 3-4 days they are much better. Worst come scenario, they will come back for 1 or 2 sessions. बट इतना ज्यादा वो करने की जरूरत नहीं होती है. मतलब they don't need to actually come back. But yes, the condition keeps coming back again and again. And steroid injection is also another option that they can do. Cycling, yes, they can do it. There is no connection because your elbow remains pretty much stable during that time. So whether you are doing stationary cycling or whether you are doing cycling on the road, yes, you can do both. There is no issue at all as such.
Okay, someone sent a question in the chat.
Yeah.
I had a ligament injury on the right knee while trekking. I had recovered up to 99.99% through exercise, but 0.1% not recovered. Sometimes it pains. What to do?
What ligament is that?
Yeah, is it a ACL?
Yeah, what ligament did you injure? It will depend on that.
Yes.
Anyways, I will just very broad spectrum talk about that. Ligament injury, if you have recovered, and if I'm assuming it's an ACL, and if you've recovered, means it was not a full tear. It must just have been a sprain or a strain. So you are pretty much lucky if you have recovered 99.99%. The 0.1% means somewhere you must be lacking in your strengthening exercise. That is the only way it has not recovered fully. So if you have continued your strengthening, another question and in another thing that you'll have to understand is that when you have a knee injury, I cannot sit cross-legged for more than 5 minutes. Is that the same person?
No, no.
Oh, no. Okay. Sorry. It's a different person. Okay.
Yes.
So, continuing that, if you have not continued, if you've done exercises and if you have not continued that for a year and a half, yes, that pain or that little pain that you're talking about, that 0.1% pain will come back. So go back to your exercises again, do them again, and then see and wait. Pain should go away. Means somewhere you have left the exercises incomplete. If they have recovered, if they have helped you recover 99%, they should help you recover the rest also.
We will take the other questions in the chat after. Let's just move to another question in the
Yes.
presentation first. I have osteoporosis in both legs with slight deformity in my left leg. What exercise should I avoid?
So if you have osteoporosis in both legs, I'm assuming the patient should be above 70. I'm assuming that. This is an assumption because osteoporosis with a deformity at a very young age rarely happens. Generally talking, it very rarely happens. What exercises I should avoid? Any exercises which gives you loading. Means any exercises which will make, like running, where you are loading your knees under pressure, weightlifting with your legs. Vazan kya hai, what is the weight of the patient is also will play a very important role, that what is the weight, how much is the weight of the patient as such. But most of the time, jumping, skipping, those are exercises. Cycling stationary kar sakte hain, non stationary nahi kar sakte hain. One of the best exercises with a deformity bhi ho, osteoporosis bhi ho, if the patient is maybe in the age group of 60 and 75 and is pretty much healthy otherwise, swimming should be one of the best ways to maintain good muscle health. So agar wo kar sakte hain, they have access to a swimming pool, they should do swimming as such. But most of the exercises that should be avoiding should be loading exercises. Any exercises which is load, because you're osteoporotic, means you are very susceptible to fractures. Means आपके legs में कहीं भी कुछ भी fracture हो सकता है. So अगर आपको वो fracture avoid करना है तो आप jump नहीं कर सकते, आप skipping नहीं कर सकते, आप भाग नहीं सकते हैं, आप leg से ज़्यादा weight नहीं उठा सकते. So those are the main things that you have to land up avoiding.
Okay, so taking the questions in the chat, I cannot sit comfortably cross-legged more than 5 minutes. A lot of stiffness in hips to upper thigh portion. Otherwise, I'm active, can do cycling 20 kilometers and walk 7-8 kilometers.
Okay, is it a male or a female? Sorry, if you can tell me.
It's a female.
Okay, so the first thing she should do is go show it to a physio and get her IT band checked. So IT band checked means IT band is an iliotibial band. The iliotibial band starts in your buttocks and it ends into your knee. It's a band which is at the side of the knee, side of the thigh. It's a big band. And this band is very common and it becomes very tight in a lot of women and men. Not only women, it becomes very tight in men also. This is also a part of the runner's syndrome. जो मैराथन रनर्स होते हैं ना, उनके IT बैंड बहुत टाइट होता है. What she's describing to me is right now that she's not able to sit cross-legged on the floor. Is that correct?
Yes.
Yes. Not sitting cross-legged on the floor is one of the symptoms of IT band tightness. Again, I need to, obviously, any physio will have to do a thorough check on her. I may be wrong also, but if that is the only problem that she's having, then her chances of her IT band being extremely tight. The moment she starts the IT band rehab, there is a whole set of exercises which are only for the IT band. The moment she will start that, her hip flexors, her buttocks, everything will open up and she will be able to comfortably over a period of time sit on the floor. वो सिटिंग तो कर लेते हैं, बैठ नहीं सकते हैं और फिर उठ नहीं सकते हैं. See, that is a very common thing with IT band. Or we not everybody, whether it's a male or a female who go to the gym, we don't land up doing enough stretches of the hips.
Yeah.
हम दूसरे बेसिक स्ट्रेचेस कर लेते हैं, अपर बॉडी थोड़ा मूव कर लेते हैं, लोअर बॉडी कर लेते हैं, बट वी डोंट लैंड अप डूइंग स्ट्रेचेस फर्दर. सो एवरीबडी हु इज लिसनिंग टू मी, प्लीज inculcate 2 days of yoga in your routine. Even if you have a gym routine, even if you have you guys have circuit training, you're playing a sport, whatever y'all are doing, 2 days a week, please go for yoga. It will do wonders and it will give you quality. You will be able to do all your other exercises with better quality.
Absolutely. I think just to add to this question from the chat, and then we'll move to the presentation question. Asha Gauri asked, I had a slight knee injury while running a decade ago. There is still some problem. What to do? I think it's a very generic question.
Very general question. I will not be able to answer that. I'm so sorry. Because it's too random and it's a decade ago, means 10 years ago. It could be anything.
Yeah. Moving on to the next question in the presentation then. My mom has knee osteoarthritis and struggles to walk on uneven surfaces. Will a condition become chronic? Any exercise tips?
When we talk about osteoarthritis, means the condition has already become chronic. Osteoarthritis is a chronic condition. Osteoarthritis means you have had wear and tear over a period of years. So it is a chronic condition. और struggles to walk on uneven surfaces with osteoarthritis, आपको क्यों उनको चलाना है uneven surfaces पर? मत चलाओ please, because it is never going to happen and she's never going to be comfortable. तो वो आप करो ही मत ना. That is one thing that you have to understand. On a regular basis, कभी कभार हो गया तो knees, in the knee osteoarthritis, she has to first of all get an X-ray. What is the extent of her arthritis? If the arthritis is very, very bad, an option of a TKR, a surgery, comes into the picture. If it is not too bad, then the most best way to actually solve this would be that she wears a knee support and goes for a walk. Exercise तो एक मतलब होना ही चाहिए. She has to exercise. She has to do some form of strengthening for her knee. वो सब तो करना ही है. But 2 things: get her X-ray done. See if the arthritis is not too bad. If it is not too bad and the orthopedic says, the physiotherapist also says कि नहीं इतना बुरा नहीं है, surgery का जरूरत नहीं है, तो you make her do exercises. Make sure that she takes physio couple of sessions and she learns all the exercises, and whenever she goes for a walk, you make her wear a knee support. And case तो chronic ही है. Exercise tips जो बोलते हैं, walking is one of the best things that she can do. Again, swimming comes into the picture. I always tell all my patients who have access to pool, who know how to swim, despite and who don't have any medical conditions, please swim. You can, yoga again becomes a very, very easy exercise or easy class for every age group to do, because we have yoga teachers and yoga classes fortunately in Bombay everywhere. So those are the main things that you can do, and your physio takes care of your specific exercises that has to be done according to the case.
There's a question, I think, and the answer is, I think, right there. I used to do regular walking for 45 minutes as advised by cardiologist and some light weights. I left it for past 2 months. Now, if I walk, I feel breathless while walking. What do you advise?
No, so cardiologist, why? Has a heart condition? Then go back to your cardiologist.
You're
If
right.
you're getting breathless again, this is not, again, my condition. This is not an orthopedic
Yes,
problem.
you're right on that.
You understand? If your cardiologist has asked you to go for a walk and now you're getting breathless again, then you need to get back and do your stress test all over again. So
Uh,
that has to be first solved, not focusing on why am I getting breathless? I mean, why I cannot walk. First, find out why you're getting breathless.
so yeah, Vivek, hope your question is answered. I'll move to
Yeah.
the next question in the
Yeah.
presentation. How can I improve mobility with lower back pain and plantar fasciitis in my left leg?
Um, okay, so we have two different questions. Lower back pain, Rohit, I already spoke in one of the questions. We spoke because back pain, when we spoke about sciatic pain, we spoke about improve mobility. Again, yoga comes in the picture because if it's just basic back pain, again, back pain, you can say whether it's muscular, whether it's a skeletal problem, bone mein issue hai, disc mein issue hai, ke muscles mein issue hai. So again, back pain becomes a very generic, very broad spectrum condition. तो उसकी mobility अगर हमें बढ़ानी है तो again the same advice I will give you. Exercise karo, swimming karo, sport khelo. If you are younger, I would say even the older people who are used to playing a sport, please continue that sport. But take care, make sure that you are doing your warm-ups, you're doing your cool downs, you're taking care of all your injuries are always going to be a byproduct of a sport. This is one thing everybody has to remember. You cannot avoid injuries. अगर आप कोई भी sport खेल रहे हो, injuries होने वाली है. वो injuries का extent हम कितना कम रख सकते हैं, that is the only aim that we are supposed to have. So whatever age group you have, please do all these things. Is the lower back pain because of sitting for too many hours? Then those changes you have to make. So all these things that are there, improving mobility of lower back, has to be done, which are specific to the problem. I cannot say that ये लोअर बैक पेन हुआ तो आपको ये करना है. मतलब क्या प्रॉब्लम है, किसके लिए लोअर बैक हुआ है, उसके ऊपर ये डिपेंड होता है. Plantar fascia is very interesting. Plantar fasciitis is basically tightness in the sole of your foot.
Yes.
Extremely common. Extremely common. Plantar fascia is also beautifully solved. If it is done in the right way, it is beautifully solved. Most of the patients who have plantar fascia will have difficulty getting up in the morning and taking the first 5 steps. वो पहले 5 steps जो हम लेते हैं ना, हमें दर्द होता है, फिर हम चल सकते हैं. So ये बहुत ही beautifully solve होता है if you go to a physio. They have a very good exercise rehab program for them. It is released very well. And after being released, normally plantar fascia, if you do the exercises regularly, normally doesn't come back. Also, plantar fascia can be triggered by bad footwear. So your footwear also has to be good quality. बहुत टाइम हम देखते हैं लोग ना बहुत हार्ड सोल जो उनका होता है, नॉट द सोल, आई एम टॉकिंग अबाउट द प्लेस वेयर दे आर लैंडिंग देयर फुट, दैट एरिया इज एक्सट्रीमली हार्ड, इट इज नॉट सॉफ्ट इनफ. दैट हार्ड चप्पल्स जो होते हैं, इवन इन मेन, ऑफिस शूज अगर आप देखते हैं तो वो बहुत ज्यादा फ्लैट होते हैं एंड दे आर वेरी हार्ड. सो दैट गिव्स राइज टू दिस काइंड ऑफ अ प्रॉब्लम, but extremely solvable. Very rarely I have seen, matlab in my 22 years, I must have seen maybe 1 or 2 plantar fascia which was not solved. And that also had other multiple issues. But straightforward plantar fascia, very well solved.
I can personally attest to that. I've had plantar fascia.
Exactly. And I'm sure it is solved,
It
right?
got solved within 3 months, never came back.
Exactly. So it is fabulously solved as long as you follow protocols.
I'll take a question from the chat and then move to the
Yeah,
presentation.
sure.
So Anita has asked, I had a slight injury on my left side hip about 5 years ago. I still feel discomfort to stand for more time. So she's not able to stand since 5 years. She has had an injury on the left hip.
Okay, left hip injury, again, very generic. Was
Yes.
there a fracture? Was there a ligament tear?
Yeah.
Was there any investigation done? And if you're not able to stand, means that area is weak. So if you're not able to take weight on that leg and stand, means there is either a weakness in your lower back or there's a weakness in your hip joint. Now that has to be diagnosed correctly for me to give any advice. That is very, very specific. So वो injury है क्या? Well, I don't know that. I wouldn't want to answer this question एकदम correctly.
Got it. I'll
So
move to the next question in the presentation then.
yeah.
I've had severe lower back pain, L5 and S1, for 26 years. How can I manage this effectively?
So okay, so this is again similarly, we are coming back to the same low back pain that we spoke about, but this is more specific. So I will explain little more specifically in this. When we are talking about L5, S1, our spine, if the audience has ever seen a spine X-ray, they will see that there are small blocks, and वो blocks के बीच में gap होता है, वो gap में disc होती है. If you see an MRI, you are able to see the disc also. X-ray में disc नहीं दिखता है, MRI में disc भी दिखता है. वो जो डिस्क होता है, व्हेन यू से यू हैव सिवियर लोअर बैक पेन L5S1 मींस आपका जो डिस्क है वो प्रोट्रूड हो रहा है. It is not possible to have for 26 years pain in a particular area if you do not have protrusion of the disc. Now that protrusion could be in multiple ways. Is it protruding in front? Is it protruding behind? What is happening in that area? According to that, your symptoms will show. According to that, where the symptoms. Now, if from 26 years, he or she has this problem and has not gone through surgery, means I'm assuming that they are at a very plateau stage. मतलब वो पेन है मगर सर्जरी किसी को बोला नहीं है. मतलब the doctor has not said कि surgery कराओ, because I'm sure for 26 years means they must have shown multiple doctors, multiple physios, I'm sure, right? तो किसी ने बोला नहीं है surgery कराओ. Means you can manage this conservatively. If you can manage this conservatively, इसका मतलब जो disc protrusion है वो बहुत ज़्यादा नहीं है. Now for this, again, physiotherapy works really, really well because it's such a chronic case and it can be solved with physio beautifully. There are lots of exercises. There are lots of core strengthening. There are lots of mobility exercises, mobility rehab, which can be done. You can use TheraBand. You can use exercise balls, everything to manage this well. Ghar pe, again, walks will be one of the best things to do. Again, the same thing, swimming, yoga, depending on the severity of the pain and the severity of how the person is improving. So these all things can be done if there has been no advice for surgery or no advice for any other investigations to be done and everything is stable. That's all.
Got it. I'll take a question from the chat.
Yeah.
Can you help with a shoulder pain which have been diagnosed as frozen shoulder and some other have diagnosed as rotator cuff problem?
Again, they both are the same thing. So whoever is listening, please listen. It is very similar to the back. When you talk about the way I spoke, that sciatica is a symptom. It is not the condition. Similarly, frozen shoulder is a symptom. The condition is a rotator cuff injury. Understand? The frozen shoulder is a symptom of the rotator cuff injury. So दोनों चीज सेम है, तो दोनों ने जिन्होंने आपको बोला है, दोनों ने सेम ही बोला है आपको. So this again can be managed very well. कितना extend है, आपका कितना हाथ उठ रहा है. You might be having, if you are a female, you might be having a problem removing the strap of your bra from behind. If you are a male, there is a lot of problem because you might not be able to lift your hand above your head, above your shoulder, from the side also. So all these things, आपका कितना खराब है, how bad is the severity of the frozen shoulder or rotator cuff injury, it all depends. But yes, again, physiotherapy works fab in this. We have a variety of exercises, but you have to understand rotator cuff injury or frozen shoulder injuries take time. So please don't lose patience. I have so many times patients coming to me and they expect like a jadoo ki chhadi type thing that, you know, मुझे अभी 5 session में ठीक कर दो. Frozen shoulder 5 session में नहीं होता है. Frozen shoulders take time and you have to be उनके पीछे पड़ जाना चाहिए for exercising. You must exercise. I have patients, and another thing is frozen shoulder is very, very common if you're diabetic. If you're severely diabetic, you will in one time in your lifetime have frozen shoulder. So diabetic patients ke liye upper body mobility is more important than anything else, so that they can avoid frozen shoulder. So make sure that they do exercises properly. You must exercise really, really well, and go to your physio and get it done, but have patience because this takes little more time and the pain is very, very severe. So I always tell my patients there are three kinds of most severe pain. One is the pregnancy pain, one is the dental pain, and the third is the frozen pain, frozen shoulder pain. इतना ज़्यादा pain होता है. So patients lose hope. They get very depressed. They get very upset because they are not able to become better. They are not able to do their day-to-day activity, and they are not able to see results fast. और इसमें कितने भी आप पेन किलर्स लोगे, ultimately without exercise nothing will work. So whoever the patient is, please remain patient and go to the doctor and get it solved.
Okay. Moving on to the next one. How does one manage? I think it's a very similar question, but
similar question. Yeah, but
how does one manage stiffness in shoulder and joint pain in knees and hips while aging?
this is like whole body, na? This is
Yes.
aging. This is aging process ka question. Again, the answers remain very similar. Activity band nahi karni hai. You know, lot of patients who cross the age of 65, 70 don't become, and especially in men. Women to better hote hain. Women, because they are even like the ones who are right now in their 70, 75, they are better because they have done a lot of housework or they have done some sort of work in the house. So they are okay. Men of that generation were not as I mean, you know, they were not as friendly with housework as what the men today are. Like the today's generation can do housework better than maybe what my father could do or our grandfathers could do. So उनके फिर वो लोग रिटायर हो जाते हैं, फिर उनको कोई स्पोर्ट नहीं खेला है, फिर वॉक लेने को जाने के लिए भी उनको धक्का मारना पड़ता है. सो उनकी एक्टिविटी बहुत कम रहती है. सो विमेन की एक्टिविटी थोड़ी बेटर रहती है इन द सेम एज ग्रुप पर से. So I always tell the elderly generation that don't stop working. Don't stop doing activity. Don't think that you have become old. अब मैं ये नहीं कर पाऊंगी. There will be a phase in your life where you will be like, okay, ये थोड़ा टाइम मुझे दर्द है, इसलिए थोड़ा टाइम नहीं कर पाऊंगी. Solve it and then again get up and do. I'm not talking about a fracture or very bad injuries. I'm talking about basic aches and pains. Don't let it stop you from living your life actively. So activity is very, very important. Our body, our joints are like our machines, right? I mean, rust ho jata hai. If you do not use them, you do not, and the oiling is the exercises. The oiling is the activity. So the more activity you do, the more exercises from walking to yoga, to swimming, to some sport, to some gymming, anything you do, some weight training, anything you do is going to improve and is going to make the aging process, it is going to retard the aging process. So that will definitely be there. But this is again very broad spectrum.
Yeah. Overall movement is medicine.
Yeah, overall movement. You have to. Do not please sit in one place. In the world of social media, which I feel even that generation has pretty much got addicted to, because you know you have even the 70s and 75 becoming very savvy with social media also, which is great. In a way, it's great. But don't forget your few hours of activity, because that can be very addictive and that can make you sit in one place for too many hours. So don't do that.
Satya has asked a question in the chat. I had my spine surgery with 10 implants and doing physiotherapy as suggested, also yoga, but I still have pain. Will you suggest something?
How long was the surgery done? If you can give me a...
There is no timeline provided to it. Satya, if you can write that down, maybe we can...
Because if it's something in the recent 1 year, it takes time. 10 implants, just surgery done in the last 1 year, please don't expect recovery for another 1.5, 2 years at least. So even if there is little pain, please continue with your rehab. Don't stop it. 5 months. Oh, that's too much, too less time.
Yes.
It takes 1.5 to 2 years for complete recovery. So please wait. It will happen. 110% it will happen. If you are on the right track, if you are doing physio and you are improving, means you will improve in the future also, for sure.
Awesome. I'll move to the next question in the presentation.
Yeah.
My 85-year-old relative needs hip replacement surgery. Is there any way to avoid surgery through exercise and diet?
Okay, so hip replacement क्यों करना है? That is a question. First question you have to ask. Did she have a fracture? If there is a fracture, you cannot avoid it. कोई avoiding ही नहीं है. Is the hip replacement because of severe osteoarthritis? Again, you can't avoid it. Because what will happen is that अगर आप सर्जरी नहीं कराओगे at the age of 85, 85 is also very very old actually, but 85 में hip replacement surgeries की prognosis बहुत अच्छी होती है. 85-year-olds after a hip surgery also do brilliantly, really really well. So avoid करना का रीजन क्या होता है? एक डाइट आप क्या कराओगे बेचारे 85 ईयर को यार? ऐसे मत करो, मतलब दैट्स टॉर्चर ना. मतलब व्हाट डाइट विल यू मेक देम ईट? चलो थोड़ा बहुत शुगर कम कर दो, सॉल्ट कम कर दो, बट खाना पीना तो यू कैन नॉट मेक देम लूज वेट एट दैट एज, राइट? That is one thing. Exercise also, there will be a limitation in what exercises they can do unless and until they have been super active. अगर super active है तो उनको hip replacement की जरूरत होगी ही नहीं. So why is the hip replacement surgery needed? Why has the doctor said that? So if the doctor has said it, there has to be a very very valid reason why it is needed. So you cannot otherwise. I know patients who are 82 and 83 years old, चलते चलते उनका hip crack हो गया है. Like they are walking, मतलब कुछ नहीं है, गिरे नहीं है, कुछ नहीं है. They are normal walking and their hips have cracked. And this has happened to my own father. He's 82 years old. वो बैठे थे, उठे and चलने लगे and his hip cracked. And we had no clue that has happened because he had no fall. Normally in your mind you always think because there will be a fall we'll need a surgery. But there was no fall and it happened, and we had to do an emergency surgery for him. So there is no, if you are needed a hip replacement at 85, I don't think so there will be any way that you will be able to avoid it. I doubt it. Any other question for this?
Not around this, I would say. There's another question. Hi, it's by Sodha Mani. I am a 50-year-old female weighing 50 kilograms, very lean body, keeps getting small hairline fractures. Now I'm very careful not to get hurt. Doctor told me to build muscles. How can I work for that? Thank you.
Okay, Saudamini, first most important thing, please, speak to your orthopedic about if you're getting continuous hairline fractures, there are these medicines that you can take which increases the calcium level in your body. They are basically those, they are injections and they work really, really well. Okay, so that is one thing you need to inquire. A lot of general public does not know about it because you need to ask that question proactively to your orthopedic. Okay, so if you ask the orthopedic that what are these injections, you have to take this one. So they give you a choice of taking one injection every month for 1 year, or then you can take, no, for 6 months, or then you can take 2 injections in a year. Something is there in that. I think the expense of that injections are a little high, so most of the doctors don't advise it. But if you are getting continuous hairline fractures, you must look into that angle also. That's one thing. Muscles to be built, when you want to build muscle, the only way to build muscle is to increase your protein. So protein intake has to go a little on the higher side. Again, if you're 50 years old, you need to make sure that बहुत ज़्यादा protein लोगे तो uric acid बढ़ जाएगा. So uric acid का balance protein के साथ आप कैसे रखोगे, especially if you're vegetarian, is a big question. If you're non-vegetarian, then that problem normally does not arise because you have other options than pulses. So uric acid भी बढ़ना चाहिए, and after that you can increase your protein, and the 100% way of doing it is weight training. In weight training also, you have to do low weight, high repetitions. If you do too high weight, you are again going to get fractures. Till you do not build fat and muscle, you need to constantly do low weights. Low weights करो मगर repetitions बढ़ा दो. Means for example, if you're doing hand के लिए 5 किलो कर रहे हो, अगर आप 2 सेट्स कर रहे थे 10-10 के ईच, आप उसके 4 कर दो, 4 के 5 कर दो, मगर वो जो वेट है वो सेम रखो, आप वेट मत बढ़ाओ. So that way you will ultimately build muscle also, but at the same time you are not loading your bones in such a way that you are more prone to a fracture. Did I answer that, Rohit, properly? I mean,
Yes, yes, that was quite elaborate, I would say.
okay.
Moving on to the next one in the presentation. Why do I experience backache after walking for about 45 minutes? Could it be due to past surgeries or leg weakness?
What past surgeries? No, because these are again very, very generic questions. ना past surgeries कौन सी हुई है आपको? Back surgeries है या कोई medical surgeries हुई है? Uterus निकाला है? क्या क्या हुआ है? उसके ऊपर only I can answer this question. I'm so sorry, but this is something. Yeah, this is something I don't know how I can answer. Leg weakness. Leg weakness क्यों हुआ है? Was there a surgery done and because of that one of your nerves had pinched and that's why the leg has become weak? So what are the reasons? What is, because this is too, I cannot give you an answer to this at all.
Got it. I'll take a question from the chat then.
Yeah.
I have runner's knee, one leg with swelling around the knee. Along with medication and physio, is going for a regular walk helpful and is cycling advisable?
We spoke about this. I think the person mustn't have joined
Yes.
at that time. Chondromalacia patella, we spoke very elaborately on this. So do you want me to repeat, Rohit, or?
No, I will. The recording would be shared so the people.
Okay, perfect. So whoever the person has asked the question can just listen to the recording. We spoke about runner's knee, chondromalacia. You can just listen to that.
Okay. So the next question is, I have cervical spondylitis causing acute pain in my neck, shoulder, and chest. Can you suggest remedies for both?
Okay, perfect. So cervical spondylosis, again, extremely common, not only in the older age group, also in the younger age group, because of the amount of gadget use that we have. आज छोटे छोटे बच्चे constantly हम ऐसे phone पे रहते हैं, मतलब we are totally on the phone all the time. So cervical spondylosis, in fact, has started developing in younger kids also very, very fast. Older में तो होता ही है, because that's age related, but younger में भी बहुत हो गया है. So one of the biggest reasons for cervical spond, there could be two reasons. Cervical spond happening because of excess of gadget use in the wrong position. Bad sleeping posture means you're using a gadget in a bad position. मतलब आप बेड पे स्लांट होके बैड पिलोज पे आप अपने आईपैड या आप अपने कंप्यूटर या फोन पे घंटों तक हो. That is one reason why it can happen. And the second reason it can happen is cervical spondylosis because of aging process. जो is normal aging process जिससे होता है, which normally post 450 सबको होता है, but it obviously does not give acute pain in shoulder, neck and all. It gives you basic pain, which is also okay. So Rohit, can I talk about both of them? Do we have that much of time?
Yeah, we have that much of time.
Okay, perfect. So when you have pain, the way I said, because of bad posture, bad pillows जो होते हैं ना, please have to be 2.5 to 3 inches and should be firm. Please don't use soft pillows. Soft pillows are one of the worst things that people normally use. So use those nice cotton pillows hai, orthopedic pillows hai. You have multiple options today in pillows, but they should be firm and they should be 2.5 to 3 inches. Unless and until you have some breathing issues, please don't use more than one pillow. People use 2 pillows and 3 pillows, but those are people who have breathing issues. उनके लिए फिर हम कुछ नहीं कर सकते. They have to use it, but if you don't use multiple pillows. So that is another way we can avoid early spondylosis. Gadget use has to be done in breaks. In today's day and age, whether it's a student, whether it's a child, whether it's a person who's in her 20s or 30s or 35s or 40s, we cannot tell them कि आप gadget use मत करो, because it is not a practical solution anymore. सबकी जिंदगी फोन पे है और सबका काम लैपटॉप पे है. So I cannot tell a patient who's coming to me with neck pain saying that, you know what, now for 1 month, don't be on the laptop. he'll be like, boss, my work is on the laptop. How do I not be on the laptop for 1 month? That is not a practical solution. What is a practical solution is how you give breaks. Means if you're on the laptop, first most important thing, change your position. Start changing the position of your laptop. What is the distance between your laptop and your chair? What is the angle of your elbows when you're sitting? Means आपका shoulder pain कम रहे. How much time you are there. So means if you're on the laptop for half an hour to 45 minutes, please take a break of 10 minutes. Now वो तो कर सकते हैं हम. अगर हम पौना घंटा अगर लैपटॉप पे रहे हैं, take a break for 10 minutes, come back again. So those are the things that we normally land up advising. So एक पिलो हो गया, एक गैजेट टाइम अगर हम दे रहे हैं तो गैजेट टाइम को आप स्पेस आउट कर दो. कंटिन्यूस 5-5 घंटे, डोंट स्टे ऑन द गैजेट. That is the most important question. I mean, the most important solution. Strengthening of upper back becomes a thing, but first we have to deal with the pain. And if the pain जो बोल रहे हैं neck से शुरू होता है, shoulder और chest में, most of the time shoulder और chest का जो pain होता है is called referred pain. Unless and until the patient is pretty much old, and if the patient has a lot of chest pain, yes, I will also tell them to go to a cardiologist and get that also cleared. You cannot just assume that मुझे cervical spondy है इसलिए मुझे chest pain होता है.
Yeah.
हम वो assume नहीं कर सकते हैं, क्योंकि अगर cervical pain एक चीज है, chest pain शुरू हो गया है, तो chest pain के लिए वो clear करना बहुत जरूरी है कि why is that chest pain happening, right? Today with a heart issue, you might just have chest pain with no breathlessness also.
Yeah.
So that is again something that you must keep that in mind. Lot of stretches are there. Lot of ways you can relieve your pain when you change your pillow, when you change the angle, how you're using your laptops, how you're using your iPads, using your phones. Lot of these things can be done. There are many exercises that are there for the cervical also. There are many strengthening exercises also which can be done. So the remedies all remain the same. When you have cervical spondylosis because of age related, there are some limitations. Means you cannot go all out and start doing weightlifting also, which I can do with people who are having this problem because of posture. Posture में जो जिनको problem है उनके साथ हम weight training भी कर सकते हैं. जिनको age related cervical spondylosis है उनके लिए weight एक limit हो जाती है. We cannot go too much into weight training. We have to do very basic weight training. Couple of kilos, little bit of TheraBand, thoda ball exercises, and thode stretches. To keep it, and also the cervical spondylosis, when we talk about it, with age-related problem, can never go away. You cannot get rid of that. You can only manage the symptoms. And that is the best thing to do. Manage your symptoms, make sure that you are taking care of all the other parameters around you, and be happy in that, because 100% pain relief होने के chances बहुत कम है. You might be with less pain by maybe 80 to 90%, but not 100%. If it's age related.
Yeah, I think even 80 to 90% is a big relief for
Yeah,
me.
but it normally does happen if you follow protocols. Everything is about following. If you follow protocols which your doctors give you, chances are very high that yes, it will happen.
Okay. There's a question in the chat. I think it's a very broad question. My hands shake. What to do?
How old is he?
I think the person is around 65, 70, I would say.
Okay, so he needs to get a neurological checkup first done, na? Hands shake. Has he done a neurological checkup?
Yeah.
Shaking of hands at resting. There are two kinds of hand shaking. Hand shaking while, we are talking about tremors.
Yes.
Tremors while doing any work, and tremors while resting. So what tremors they have, please get a neurological checkup done, because this can lead to Parkinson's. So again, this is not totally my lookout till he's not diagnosed properly.
I'll move to the next question in the chat.
Yeah.
I have a calcaneal spur on my left heel and flat feet, which cause difficulty walking even with insoles. What should I do?
Okay, so we spoke about plantar fascia, right? So plantar fascia jinko calcaneal, okay, so calcaneal spur, I will explain what calcaneal spur is. Calcaneal spur means कि आपकी जो heel की जो हड्डी होती है, which is the calcaneal bone, वो बढ़ जाती है. It basically starts having spikes. Okay, now that spike might push into the soft tissue, giving you pain. The symptoms of calcaneal spur are very similar to plantar fascia. Means जिनको calcaneal spur है उनको 100% plantar fascia है, मगर जिनको plantar fascia है उनको calcaneal spur हो वो गारंटी नहीं है.
Okay.
Till you do a X-ray. Okay. Again, flat feet, calcaneal spur are not connected. Some people may have calcaneal spur without flat feet. Some people may have flat feet without calcaneal spur. If this person has both of them, that is unfortunate, but they are not connected to each other. But calcaneal spur and plantar fascia are connected. वो calcaneal spur वालों को plantar fascia होगा ही होगा, because वो जो आपका soft tissue pinch होता है ना, that pinching of soft tissue will tighten the whole fascia of the sole. So treatment of plantar fascia and again calcaneal spur does not go away. वो जो spike हुआ है वो spike आपका जा नहीं सकता है. हम उसको सिर्फ maintain कर सकते हैं by keeping the symptoms low. There is a fabulous rehab for that. Lot of people do lot of exercises and they can maintain it. Good shoes are very, very important. Difficulty walking with insoles is not because of calcaneal spur, would be because of flat feet. Calcaneal spur mein insoles work really well. Okay, because your heel, especially, I don't know whether you guys have, anybody knows, I don't know whether Rohit, you know, you have the gel insoles?
Yes, I know insoles, yes.
Correct. So they work really, really well. Normally they work well. Flat feet में अगर insoles में issue है, that means insoles का जो material होगा ना, वो material बहुत hard होगा. What is flat feet? Flat feet is when you lose. When we look into our foot, now we all have an arch.
Yes.
What does that arch do? That arch protects you from shock absorption. It's a shock absorber.
Yep.
Basically, it protects you from any sort of shock. मतलब आप अगर stationary रह के jump करके नीचे आओगे, तो आपको वो jump का impact, if you have the arch of your foot, इतना ज़्यादा नहीं होगा. But if you jump and you come down, and if you have a flat foot, the impact will be a little higher in those people. So your foot, that means your sole, and your knee, they all work as shock absorbers. So they absorb the shock which you have, the friction which we have during walking, during doing any activity. So that's the reason the arch of the foot is very, very important. But there are a lot of people who are born with flat feet. So that is not a problem as such. It is okay. It is very much, you can do a lot of strengthening especially if it's detected at a younger age. Nowadays, parents are so aware. हमारे बच्चे 10 साल का हो गया, उसको flat feet है, अभी हम क्या करें? So they all come at a very younger age. Most of the toddlers are flat foot. So please 2 साल और 3 साल के बच्चों को मत लेके जाइए, क्योंकि उन लोग सारे flat feet ही होते हैं. As they grow older, their arches start forming. So 10 साल 12 साल के बच्चे आते हैं flat feet के साथ, and then we start with flat feet rehabilitation. We start with exercises to increase the arch, but obviously the full arch will not come back. We give correct footwear also. The footwear with insoles are given correctly. If the insoles are a good quality, normally difficulty nahi hoti hai. So it all depends on the quality of the insoles. So that needs to be changed. Exercises for flat feet are also are normally given, and they should be followed as such. Flat feet will not trouble you if that is not affecting your knee. जब हमें flat feet होता है, I mean, I need to explain this visually, so I will just do it with my hands. Can everybody see my hands?
Yes.
Rohit, my hands are visible?
Yeah, it's visible.
Yeah. Okay, so basically, आपका foot है. Flat feet means ये अंदर का जो जगह है flat है, यहाँ arch नहीं है. There is no arch here, right? So this area is flat. Means when this is flat, means आपका जो knee joint है ना, वो internally rotate हो गया है. Means there is pain on the knee joint also. So people who are older will come and say, I have flat. They will not come with a flat feet. They will say, I have knee pain. But that knee pain is because of the flat feet. So the moment you give them good insoles and you raise the arch because of the insoles, वो knee pain चला जाता है.
Nice.
You just change the angle. That's it. So they don't even realize they have flat feet. They come to us because of the knee pain. And that's when the diagnosis happened कि आपका knee pain, and there is no reason for the knee pain. He's a young guy, 30 years old. Knee pain क्यों हुआ? पता नहीं है क्यों हुआ. सब parameters okay हैं, and then you realize it's flat feet. So flat feet की वजह से knee pain होता है. That's why they come, and it is pretty much again not 100% treatable, but manageable. So you can manage it.
I think that's quite a depth answer. Now
Yeah.
let's move on to the. I think that was the last question on the presentation.
Okay.
For anyone who is raising their hands, please. We have answered most of the questions that are in the chat. I'll keep it open for the next 2 minutes. If you have any questions, please put it in the chat and we'll take it up. Though we have crossed the time limit already by 5 minutes. Yes, Mrs. Meeta, Madhu ma'am, Satya Sathai, could you all, like, you have raised your hands. If you can just type your question in the chat, because we can't open the mic on a public forum here. Okay, I think we don't have any more questions. Thank you, Vibhuti.
You're most welcome. Thank you for such a lovely audience. Thank you, Rohit. You were great. Okay, again, the questions have started coming.
Yeah, okay. Yeah, the two questions are: is it okay to cycle with
No,
IT band?
no.
So not
No.
to cycle if you have a IT band.
No, not yet. It needs to first get released. You need to release the IT band and then do cycling. I mean, it's not that she can't cycle lifetime. First release it.
Got it. So yeah, Madhu, first need to work on the IT band stiffness, then cycle. Shaya Prakash asked, why does frozen shoulder happen? I think you have already talked about.
Yeah, we spoke about this at length.
It's a rotator cuff injury that manifests itself as frozen shoulder. And okay, which yoga asanas to avoid for knee pain? I think that's the last one.
So when you have acute knee pain, please don't go for yoga. Extreme knee pain, wait. Finish your physio, strengthen your knee, and then wear a knee support. If you have recurrent knee pain, wear a knee support and then go for yoga. Every asana you can do. There is no problem. Yeah, so if it's not severe, please wear a knee support and do all the asanas. In fact, yoga will help you in your knee pain. But wear support, please. Without support, don't do it.
Okay. Yeah, I think that was the last question. Thank you, Vibhuti, for all the information.
Most welcome.
Lovely session.
Yeah, thank you so much. Bye. Yeah, bye, guys.
Bye.
Yeah, bye.